The media provoking fear in parents that their children are at severe risk of contracting COVID-19. But my next guest says that we shouldn't believe in all that hype. That is the argument that she makes in her new op-ed titled "The COVID Pandemic is Over. Let's Stop Punishing the Innocents," our children, our kids. Fox News medical contributor and author of Panic Attack that hits store shelves tomorrow, Dr. Nicole Saphier. She joins us now. Good morning, Dr. Saphier.
Good morning, Ainsley.
Good morning. I read your op-ed and I love your message. Why did you think this was important?
Well, listen, Ainsley, the pandemic may be far from over, but the emergency certainly is, as we have now hit an all-time low for daily deaths, new cases, as well as hospitalizations. We have gotten to a level of acceptable risk previously during bad flu years and other circulating respiratory viruses. Now that over 60% of U.S. adults have gotten at least one dose of that vaccine and it's being extended to adolescents, it's time to acknowledge the emergency is over and move forward, especially when it comes to young children. As we know, we have known for a while, but we continue to have more data that young children are less severely affected by this virus and they have a less risk of transmitting it. New data from the CDC just out last week shows the biggest way to prevent viral transmission in elementary schools is not by masking the children, it's actually by improving ventilation and masking teachers. And that was before we had a vaccine. We now have data showing that if you're vaccinated, you're not spreading the virus. It's time to get kids back to school in person, and it should not be contingent upon vaccinating the children or even them wearing masks.
According to Hospital Pediatrics, 40% of pediatric hospitalizations for COVID-19 were overcounted. You write about this in your op-ed. You say, to put it bluntly, because hospitals have instituted universal testing of patients, incidental positive cases were found when kids were admitted for other reasons, including mental health disease and orthopedic fractures, not from symptoms of COVID-19. If we are truly to follow the science, we must allow children to resume their normal activities. How are these numbers inflated?
Listen, there's nothing nefarious going on here, Ainsley. I see it all the time. Patients are coming in for a biopsy, and we were doing COVID tests, and if they were positive, we said we had to wait. They didn't have symptoms, but they were positive. Same as going with children. About 46% of those kids were actually asymptomatic to COVID, but they were treated as a COVID hospitalization because they were in the hospital and they tested positive. There is a perceived level of risk when it comes to this virus in young children. That perceived level of risk does not equate to reality. Now, listen, SARS-CoV-2, that is a tricky virus, and I don't want anyone to get it because it's unpredictable. And that's not to say that some children aren't severely affected by it, especially MIS-C. But I can tell you, Ainsley, there are other pathogens circulating that we have deemed an okay risk, that we have not halted life. And when it comes to SARS-CoV-2 in young children, I believe that that risk is very low, and it is time to resume activities for them because we know the consequences of not doing that will far outweigh that of the virus itself.
That's right. That's right. Tell us about your new book. It hits shelves tomorrow, Panic Attack.
Ainsley, come on, you know I've been working on this book for a long time now, and the one thing that has continuously happened throughout this entire pandemic is fear. And there's been a lot of fear, and there's been a lot of questions asked that people don't have answers to. So what I wanted to do in the book, I took the most controversial topics that people had a lot of confusion about. I broke through the confusion. I put only facts in because I feel if you educate yourself with facts, it takes away the fear. Facts over fear. I challenged, why weren't we allowed to discuss the possibility of a lab leak? Why did the media hate hydroxychloroquine so much? Why all of a sudden was Dr. Fauci deemed the white knight and President Trump the villain? Did that really turn out to be true? All of a sudden you saw big tech censorship of any contrarian opinions, many of which actually have turned out to be true. And then I actually divulged into, were those lockdown protesters right all along? We tackle the most controversial topics, including face masks, school closures, hydroxychloroquine, and many others, including the viral origin. We break through all of this hype and we get to the facts. And therefore, if you have the facts, you can have your own opinions. You don't need the media to give it to you.
I am so proud of you and all your success. We know your story, and you're a dear friend of mine, and just so happy for you.
Thank you so much,
You're
Ainsley.
welcome.
It's available everywhere tomorrow, but you can pre-order it now.
That's right. That's right. I'll do that right now. I'll go to Amazon and pre-order. Thanks, Dr. Saphier. Panic Attack is the name of her book. Everyone go pick up a copy.